Hi, everyone. Welcome back. I'm Dr. Samantha, and we are here again for one of our live Q&A sessions that we have every Monday at 9 p.m. Eastern Standard Time. This is your chance to ask any questions that you might have of me live and my chance to interact with you guys. This is also my chance to answer any of the questions that you guys have submitted onto the channel over the course of the last week. Remember, we're also on Facebook, Instagram, and Twitter for additional content. Those will be linked. Please go ahead and share this channel with your friends and family. We really appreciate all your support. Remember to hit the like and subscribe buttons. For those of you who stick with us until the end, I will give you a sneak peek at tomorrow's video. And I am also very excited to let you guys know that we have been accepted to be a part of the YouTube Health platform. So that's very exciting for you guys because as part of that platform, you can trust that I have been vetted and verified by YouTube as a legitimate provider of quality healthcare information. So I'm going to go ahead and get started. Usually I start out with questions from the videos, but we had a question actually from Jasmine who was waiting as she waited for the live, and she had put it into the chat. So I'm going to go ahead and I'm going to start with that one. So she said, if my baby has a tongue tie, but there are no troubles breastfeeding, should he still get a frenotomy? Is it necessary to prevent future issues with eating and speech? So this is a great question, and I love to talk about tongue tie. So for those of you who may not know, I've been a lactation consultant for over 12 years now. So I have a lot of specialized training in breastfeeding. I am pro formula as well. But of course, part of being trained in breastfeeding is to understand how the mouth works and the tongue and all that other stuff. So when a baby has a tongue tie, that refers to a band of tissue or a kind of string of tissue that anchors the tongue to the floor of the mouth. There is also a lip tie, which is a band of tissue that's up here underneath the skin, and it kind of anchors the upper lip to the gum, making it hard for the upper lip to flange out. Now, the lip tie can also wrap around the gum, so you may actually see that tissue kind of go around. Now, when a baby has a tongue tie and there are no issues breastfeeding, this question often comes up. Should you get a frenectomy? So frenectomy is basically the revision of the tongue tie. If you have the little stringy kind of tip at the end tongue tie, that one can usually be snipped with a pair of sterile scissors. This is still done by a pediatrician or by a dentist or somebody who's been trained to do it. For tongues that have the posterior tongue tie, so this is a thick band that's kind of further back, those revisions need to take place either using a laser or a cautery tool. Again, these are done by people that have had specialized training in this type of procedure. So when we talk about getting those procedures done, they're kind of invasive. So parents often wonder whether they should get it done. One of the reasons to consider this is potentially future issues with eating as well as future issues with speech. So with the speech thing, there's no way to know in advance whether your baby's going to end up with speech issues. Now, when we talk about speech, this isn't speech like they can't say words. It's usually either slurring or it's pronunciation. So having trouble pronunciating certain sounds. This is usually pretty easily fixed. You go to speech therapy, which is very non-invasive. They work with a speech therapist to kind of stretch out their tongue and get used to making those sounds. Now, sometimes a child won't be able to get through that. And if they can't, they may recommend a frenectomy at that time. So kids do get frenectomies or revisions of their tongues later on, 4 years old, 5 years old, 6, 8, 10. I mean, it can happen at any time. But once they are past the 2-month mark, usually it requires the child to have anesthesia. So it's actually like a surgical procedure. So it's important for you to understand when you're making this decision that later on, you may need to have your child under anesthesia to fix it. I have not, generally speaking, seen any tongues that are tight cause any feeding issues if they did not cause feeding issues in the beginning. I have worked with families that had babies who were formula feeding or bottle feeding only and had issues with feeding due to a tongue tie and needed a revision. So, but usually if they're going to have feeding troubles, that happens early on. Now, the lip tie that I was mentioning, if that is revised early, sometimes that will prevent a child from getting the gap between their teeth. That gap that you see in front of a lot of teeth, that's actually caused by a lip tie. And one of the most common people to actually revise a baby's tongue are dentists, because dentists often have to do that lip tie revision when kids are getting braces later on in life. So believe it or not, if you get this revised early on, you may prevent the need for braces. But of course, none of that's a guarantee. So what I would tell you, Jasmine, is, it is definitely a decision to make. I think the stringy outer tongue tie is usually the one that's definitely most likely to cause a speech issue. The posterior tongue ties is just hard to say. So you kind of got to decide what's best for your family. But that was a great question. So I really appreciate you asking that question. Any of you who are joining us, please feel free to put your questions into the chat like Jasmine did. I'm going to go ahead and get started with some of the questions that you guys have asked onto the videos this week. So I'm going to start with bleeding. I'm 6 weeks pregnant and I started bleeding 3 days ago, only when I sit on the toilet. I took a pregnancy test this morning and it's still positive, and I'm not seeing my doctor until the 5th of February. And that makes me very scared. Am I having a miscarriage? Bleeding during pregnancy is extremely worrisome. Another question we got is it normal to have light bleeding at 8 weeks pregnant? I'm really worried. There are many causes of bleeding that can happen during the first trimester of pregnancy. And it's very hard for us to figure out as a pregnant person whether this is normal or not normal. So starting out, if you're seeing bleeding, you need to call your healthcare provider. That's like number one, because you can't see what's going on inside. So in our first question, the viewer said that she took a pregnancy test, still showed that it was positive, and yet she was bleeding. So the first thing you guys need to know is, unfortunately, you could have a positive urine pregnancy test and be having a miscarriage or have had a miscarriage. So the urine pregnancy test tests for HCG, human chorionic gonadotropin. This is basically the hormone that shows whether you're pregnant or not. And so when you pee on a stick, there is some of that HCG in your urine. And if your stick shows it, finds that, then you get a positive result. But that doesn't actually mean that the pregnancy is going well or that you may not have already had a miscarriage. So when you're bleeding, you need to call your healthcare provider, and they may do a couple things. First, they may do an ultrasound. The ultrasound is to look inside and determine if there are any issues that we can see. For example, placenta issues or issues with the cervix. So that's number one. They can also try to see if they see the baby. Do we have an ectopic pregnancy? Is the baby inside the uterus? What's going on there? Now, the other thing we might do is a blood test, a blood pregnancy test. So the blood pregnancy test also tests for HCG. Now, we know that when you're a certain gestation, meaning if you're 8 weeks along, your HCG level should be a certain amount. Now, I can't tell you the exact numbers, guys, so please don't ask. It's just the numbers continue to rise as the pregnancy goes up, and we have an approximate range for every week that you're pregnant. Now, if you are bleeding and they do an HCG level, they're going to ask you to come back and draw your blood again to do a second HCG blood test. If that number is rising, that means the pregnancy is progressing probably in a normal, healthy way, even if you are bleeding. If the level is dropping, that means an imminent miscarriage is probably going to happen. Now, once the miscarriage takes place, unfortunately, you're still going to have HCG in your system for a little while. Can be up to a couple weeks. So if you haven't been assessed by a healthcare provider, you may be showing a positive pregnancy test and you may not actually be pregnant. Again, this is why it's important to be checked. Now, one of the questions that we got said, I had sex with my girlfriend 2 to 3 days before her period, and that was our first sex. After 8 days, she told me she missed her period and she is pregnant. Can such a thing happen? So, this is a great example of understanding cycles and trying to determine what is what. So, you can have a menstrual cycle, okay? And then about a week after the menstrual cycle is when you're going to release the egg. And that egg then travels into the fallopian tube where it's met by sperm. And then if it's fertilized, it goes into the uterus, and that's your pregnancy. Now, when that pregnancy enters the uterus, it has to attach to the uterine wall, and you can get something called implantation bleeding. So this can happen very, very close to the time that the egg was fertilized. Now, in this case, it is possible that you can ovulate during your period and that you could get pregnant and be potentially pregnant that close to the time of sex. However, it's not very likely that you'd be able to get a positive pregnancy test. Sex is one of the main causes of bleeding during the first trimester. Now, sex is safe unless your healthcare provider has told you you cannot have sex. Sex is very normal, it's natural. But the pregnancy hormones that are needed to have a healthy, safe pregnancy, they thin out the vaginal tissue and they kind of dry it out. And so it's very easy for you to start having little micro bleeds because of any kind of sexual intercourse, especially if you're dry. So this is one of the common causes. You can also have the implantation bleeding, and then you can also continue to have your regular period. A lot of women will have 1 or 2 more regular menstrual cycles while pregnant before they stop having a menstrual cycle. And while this sounds scary, there's many women who have normal, healthy pregnancies, even though this is happening. And finally, you may have bleeding because you have an infection, which is why it's so important for us to check things out. Now, another viewer wrote, I've been having extremely mild, more uncomfortable, painful period-like cramps since about 3 weeks pregnant. Last night at 4 weeks, I had light brown spotting, not a lot, but this is enough to freak me out. More spotting this morning. Is this normal? So while I have just explained to you that there are potential reasons why spotting and bleeding can be normal, it is not normal for it to continue to increase. Okay. You need to get that checked out. More and more bleeding is a sign that something's going on. Brown is old blood. And we have a video on the colors of blood and some of the discharge that we can link into the description. But brown is old blood. But if you have red, that's a sign of active bleeding. And eventually that active bleeding will turn back into brown. But if brown is the first thing you're seeing, that means at some point in time you were bleeding internally. We need to figure out why. So it's so important. Again, I can't tell you enough. You need to contact your healthcare provider if you're bleeding. For those of you who are joining us, please feel free to put your questions into the chat. I'm going to move on to some questions that we had. So we had a question. I was 6 weeks pregnant. I took azithromycin for urinary tract infection, and a week later, I started bleeding. So when you are given an antibiotic for use during pregnancy to treat an infection, it should be given for a bacterial infection. So antibiotics kill bacteria. They do not kill viruses, yeast, or funguses, okay? Only bacteria. So in order to receive that type of medication, you need to be tested. So if you have some kind of discharge, they need to bring you in, swab the discharge, send it to a lab, and see what's going on, what is coming out. If you have a urinary tract infection, this is where you have an infection of the bladder. They have you give a urine sample. They can see the bacteria in there. Then they can determine what to give you. Then we will give you an antibiotic. Now, why is it so important to take antibiotics? If you have any kind of infection, yeast, fungus, bacteria, viral, this can give you an increased risk of miscarriage, stillbirth, and preterm birth. Now, in order for these things to happen, what happens is the infection infects the vagina, the cervix, and the uterus. It basically starts to invade everything. And when that infection starts to spread, everything becomes irritated and you can bleed. Now, azithromycin has been looked at as far as women using it for different types of infections. In fact, it's extensively used. It can also be used to treat certain sexually transmitted diseases. So it is widely used, and there has been no evidence that it's harmful during pregnancy. Now, we cannot do actual like full-blown studies on pregnant women. It's not ethical, but we do studies on animals. And in rats were given 4 times the amount of a normal human dose, and there were no issues with any of the rat embryos. So we believe that azithromycin is safe. Now, another viewer asked, is clindamycin safe while you are 7 weeks pregnant? So clindamycin is another antibiotic. And for this one, it appears to be safe. There's been more studies or more examination of the use of it in the second trimester. So in the second trimester, it seems to be, pretty good. And what we know is it's so important to treat an infection and treat it properly that it would be better to take something versus nothing. But this becomes a risk versus benefit thing. So whenever you're given a medication for any kind of infection, you want to talk to your healthcare provider about the risks versus benefits so that you can make an informed decision. When you decide that you're going to take an antibiotic, you need to take all of it, guys, every single bit of it. You don't want to just take some of it, because this is what leads to antibiotic resistance. And I think a lot of people don't quite understand how this happens. So I like to always describe it. So if you have all these, like an army of like bacteria that you're trying to fight, you bring the antibiotic in and it starts taking out the front line. But these guys in the back, they're figuring out how to defend against this new weapon, which is the antibiotic. So they're figuring out all the tricks. And in the meantime, they're also building up a wall of defense. And then they're calling in for reinforcements. Now, you start with your antibiotic and it starts knocking away and you start feeling good. In fact, that's one of the nice things about antibiotics. You start feeling good in like a day or two. And you're pregnant and you're like, oh my gosh, I don't want to expose the baby to more, medication than I need to. So I'm going to stop. So you stop taking the medication. Well, that's no good, because what happens is the back line, they build up this defensive wall. They get all their reinforcements in. So in a couple of days, you start feeling worse again. So then you're like, oh, I guess I need to finish the antibiotic. So you restart. But what happens is you restart the medication and it doesn't work. And when it doesn't work, then you're like, oh my gosh. And you end up having to go back to your doctor, and we end up having to give you something that's a lot stronger. It's a lot more like hard on you and potentially hard on the baby. So it's important that when we're giving you that first line of defense, if you decide to take it, then you need to take all of it as prescribed. Don't just stop when you're feeling better. So that was a great question. Now, going further into this, I'm going to go to our yeast infection videos. Okay. So our yeast infection videos, we had a question that said, can I take metronidazole at 5 weeks pregnant? So this is a good example of asking information to figure out whether it's right for you. So metronidazole is an antibiotic. Okay. So remember, guys, I told you antibiotics fight bacterial infections. They don't fight yeast infections. Now, I don't know for sure what kind of infection this viewer had, but it was on my yeast video. So I'm going to assume yeast. If you're given metronidazole for a yeast infection, it's not going to work. It doesn't treat that. It has no use in that respect. However, metronidazole is really good for the treatment of bacterial vaginosis. And for more information on that and some of the sexually transmitted diseases, we can link some of those videos into the description. Now, this is why it's so important to make sure you know what you're getting treated for. Metronidazole, just to answer the question, is used very commonly throughout pregnancy, and it's safe at the lower doses. But it's something that you can talk to your healthcare provider about. Now, another viewer said, what medication can I use to treat urinary tract infections? So, urinary tract infections are pretty much universally caused by bacteria. So, bacteria, the only way to kill that is with an antibiotic. Urinary tract infections can be a little tricky because with urinary tract infections, a lot of people have heard that there's a lot of homeopathic natural remedies for urinary tract infections, like the use of cranberry juice. So, what I need you guys to know is that these remedies have a potential to help um, discourage the growth of bacteria in the urinary system. But when you're pregnant, you can't afford to let an infection go untreated. I have seen women deliver preterm at like 24 weeks pregnant due to a urinary tract infection. So these things need to be taken seriously and they need to be treated quickly, because one of the things that'll happen is the urinary tract infection will go up to the kidneys. So the thing is, the reason why women get urinary tract infection so easily is you have our bladder, right? And the bladder is connected to the outside by a little tube called the urethra. And the urethra is short, it's little teeny tiny, and the hole is like right next to your vagina and your anus. So when you're going to the bathroom, you always need to wipe from front, which is the clitoris, and the urethra, to the back towards the anus. If you wipe the other way, you can bring bacteria from the anus and the vagina up to the urethra. And that urethra is really short. So that bacteria, if it's right at the hole, it's just going to go up. So then it enters your bladder, right? And your bladder, it's being compressed by the baby. So no matter how often you pee, a lot of times a little bit of urine gets left over. And that urine that gets left over, that is the perfect environment for bacteria to grow. So it starts to grow in there and it's like, it's great, right? They love it. So then if it's left untreated, that bacteria then goes up the ureters. So you have two ureters that go up to the kidneys, okay? The ureters are also small, so it's very easy for them to travel up, and then they get to the kidneys. Now, your kidneys are used to filter your blood. What they filter out ends up being your urine, but it's actually filtering toxins out of your blood. So if you have a kidney infection and your kidneys stop working, you're going to start to feel sick. But on top of it, because it's filtering blood, that means if you get an infection here, that infection can get into your blood and now you have sepsis, and sepsis is life-threatening. So this is why it is so, so important that you take a urinary tract infection seriously and you get it treated. Now let's go back to some of those homeopathic things. Cranberry. Okay. Cranberry juice is this thing you hear about all the time. Cranberry juice will treat a urinary tract infection. It will not. If you have an established infection, it will not. However, cranberry can be used to prevent a urinary tract infection. So the use of cranberry juice or cranberry pills actually will acidify the urine more, which will inhibit the growth of bacteria. So that's how cranberry actually works. It acidifies urine, making it a hostile environment for bacteria. Now, the other thing is you guys need to drink whatever you want. Okay. I know everybody like harps on water. Yes, water's great. I don't care what it is. Soda, coffee, tea, you name it, just drink it. Because the more you drink, the more you go to the bathroom. The more you go to the bathroom, the less likely you are to keep that bacteria in the bladder, which could cause the infection. Hi, Zarin. I see your question. I am 4 weeks pregnant and I'm having grayish brown discharge this afternoon. Is it normal? So it depends. Brown is oftentimes the sign of old blood, but at 4 weeks pregnant, that could actually be the remnants of implantation bleeding. So very early on, 2 to 3 weeks into your pregnancy, when the baby's coming down from the fallopian tube and attaching to the uterine wall, there can be some implantation bleeding, which can be very small. It can be just a couple spots, and that can cause some bleeding. Some women will see that as like a bright red, but other women may never see that, and they may end up with a little bit of brown discharge. Now, grayish discharge, that can be the sign of other types of infections that you would want to go ahead and get checked out, because there are certain infections that you can get that might be causing a gray discharge, and those can be treated very easily. And one of them is bacterial vaginosis, which we've just been talking about. So, for those of you guys who don't know, bacterial vaginosis gets lumped into the category of sexually transmitted disease. It's because it's in the vagina, and sometimes the male partner can contribute to you getting it, but it really isn't a sexually transmitted disease. So, bacterial vaginosis is caused by bacteria that's normally on the skin. It can be on the woman's skin, like the skin of her vagina and her pelvis and her hips and all that stuff. It can be on the male skin, the penis, the scrotum, his belly, like any of that. So it can be on either party's skin. Okay. It's just normal skin bacteria. What happens is that bacteria gets introduced into the vagina. Okay. And when a man ejaculates and his sperm goes into the vagina, it changes the pH. So it makes it, instead of being acidic, it makes it more alkaline. Basically changes the environment. But that change is enough to allow this particular bacteria to grow. It's a little bit easier for it. And that's how you get bacterial vaginosis. So again, it's not sexually transmitted. It's normal bacteria you have, but when your partner might be a little dirty, or you might be a little dirty, maybe everybody's sweaty and you're having a good time, you don't think about it, that can be the perfect storm for developing this. And you actually want to go ahead and take an antibiotic, but they need to swab you first. I actually went through IVF this month, and while administering vaginal progesterone this afternoon, I noticed the discharge. So that could actually be remnants of the actual IVF procedure as well. Could be implantation bleeding, and it could be that. And depending on if you are doing more like the vaginal progesterone, it could also be, if you've had it in a couple days ago, that could be causing it. Now, one of the things I would tell you, Zarin, is you want to call them tomorrow, especially if you're going through IVF. You want to get this checked out right away. You want to let them swab you, because they can swab a little bit of that discharge and see, is it some medication? Do they see some blood? It could also absolutely be normal vaginal discharge. Guys, there is normal vaginal discharge during pregnancy still. Like, you can still have, it's usually clearish, but some women will describe it as a slightly off, like a slightly different kind of color. So yeah, and that doesn't surprise me at all that they're saying it's normal. But that's a great question to ask, and then you just keep an eye on everything. You definitely just keep an eye on stuff. So I'm glad that you got the same answer. Anybody who has a question, please feel free to put it into the chat. And actually, I'm Dr. Samantha for anybody who's joining. Hi, the maternity mentor. We're here for one of the live Q&A sessions. Please put them into the chat, and then you stick around until the end. I will give you a sneak peek at tomorrow's video. We had one more question on the yeast stuff, which I thought was really good also. I have been to the doctor twice, and the yeast infection keeps coming back. I am frustrated. So this is a really good example of treatment resistance. I'm sure this is treatment resistant yeast. Just like an antibiotic, if you start taking something, you have to take it to completion. The yeast products, the fungal products, all of it, there's a lot of resistance from these pathogens because people don't take the medication as directed. So you need to make sure you're taking everything as directed. Now, A lot of times, your healthcare provider will be advising you to just use an over-the-counter product. A lot of the over-the-counter products that you walk into the store and see are safe for use. You always need to check, but most of them are safe for use during pregnancy. The biggest thing is I actually find that some providers don't want you to use, there's little like ampules or like pills that you can insert in the vagina. Some don't want you using those, some don't want you using the cream. So it's actually also important to figure out which type your provider prefers. Sometimes, if it's more treatment resistant, we have to give you diflucan. Now, diflucan is extremely controversial. If you look online, there's a whole bunch of stuff that say, don't take it, it's really bad. And there is evidence to say that at high doses, diflucan can have negative impacts on your pregnancy, including causing miscarriage. However, at lower doses that can be used for yeast, we sometimes will use it and it's completely safe. And ultimately, a yeast infection can also potentially cause miscarriage, which is why we need to get it treated. So, the biggest thing I would tell you guys, especially this viewer, is if you are having treatment resistant yeast, you need to go ahead and you need to like ask them, what else is going on. Now, the other thing is, guys, this is a really good example of why we need to talk about just vagina health in general. Okay. So, one of the things is, guys, our vaginas need air. They're dark and moist, and we've got bacteria down there that's normally there, and you just get exposed to all this stuff. So your vagina needs air. So at night, don't sleep with underwear on if you can. It's really, really, really good for your vaginal health. Additionally, you guys don't want to be using any kind of douching products or anything like that. All those fancy like cleaning products that we see, you don't want to be using any of that stuff because that stuff's really bad for the pH of your vagina and can actually make things worse. You guys want to be eating or taking a probiotic. Our entire health is related to our gut. If our gut is not right, the rest of our health is not right, including our vaginal health. Make sure you're using like clean soaps, like just fragrance free, just normal soaps. And I'm sorry, guys, like pregnancy is usually not the time to wear those really nice, fancy underwears. Those silky underwears and all that other stuff are actually really bad for your vagina. They can actually cause the vagina to be like more hot and grow bacteria and all this other stuff. Cotton underwear is absolutely the best. So this is one of the things that I want you to think about. Okay. So, let me go ahead and answer, some other questions that you guys had. So we had a question about asthma, which, was a great question. It was on one of my live videos. I don't actually have a video out on asthma, probably something I'll put out for you guys. Says, I'm currently have asthma while pregnant. Are the steroids I am taking safe? So for this viewer in particular, I cannot answer because I have no idea what steroids you are taking. This highlights that if you have questions about medications and you're not sure if your healthcare provider is giving you enough information to make an informed decision, you can actually go to your local pharmacist. Pharmacists have specialized training in medication, and they can talk to you at great length about the safety of use of certain medications during pregnancy. Now, that being said, there are a couple different types of medication, steroids that can be used during during asthma. So you have oral steroids, which is usually either prednisone or dexamethasone, and then you have the inhaled steroids. So the inhaled steroids, honestly, there's some that you can't use at all the way up to some that are perfectly safe. So you really need to have an extensive discussion with your healthcare provider. When it comes to prednisone, oral prednisone tablets is not safe during the first trimester. Is absolutely known to cause birth defects and miscarriage. In the second and third trimester, it can actually be used depending on what else is going on. For dexamethasone has been associated with cleft lip and cleft palate. These are malformations of the lip and the roof of the mouth. It has been associated with that in the first trimester. Second and third trimester seem to be safe. Now, that being said, a mom who's having active asthma attacks over and over and over again during pregnancy, if she's not exchanging air properly, that can be detrimental to the baby because the baby's not getting enough oxygen. This is why this is a risk versus benefit discussion that needs to take place. So I'm really glad that this person's thinking about that. You definitely need to talk to your healthcare provider. Is there any extra precautions that should be taken during the first trimester that will help with having a successful pregnancy? So, Zarin, this is a very common question that a lot of people ask. And unfortunately, there is not a lot that we know for sure will help. What I can tell you is reducing your stress is key. So I'm a psychiatric nurse practitioner now. I started in this arena and then I moved over into psychiatry to help medicate women who are pregnant and postpartum breastfeeding. Because a lot of providers would tell women they could not take medication for, say, anxiety and depression. Anxiety is a form of stress. Okay. The reason why it's so important to medicate a pregnant woman during her pregnancy, for anxiety is because when you are anxious or depressed, your body's releasing stress hormones. And those stress hormones are attacking all your cells, like everything. It's creating this environment that's very toxic. And now remember, your baby is trying to grow in this environment. So it's that stress can really have a serious impact. And we are now understanding that untreated anxiety and depression during pregnancy can lead to miscarriage. We are also understanding that the average person has a 2% chance of having a baby with having a baby with some kind of birth defect. We now know miscarriages are more and more common. But women who take an antidepressant don't have an increased risk. In fact, they have a decreased risk sometimes of birth defects and miscarriage because they are getting that treated. Back to your question, Zarin, this highlights the importance of reduced stress. The number one thing is reduced stress. Now, that can look different for everybody. Some people exercise helps them to reduce stress. Now, with IVF, you may have been told not to exercise because I do understand in the IVF world, there are some restrictions that are often placed. So it could also look like watching your favorite, television show every night. It could look like, taking lots of naps and getting extra sleep. Whatever it is that you need to reduce stress, that's the most important. And then a lot of self-care, a lot of things that make you happy. You want to make sure you're eating healthy, you're drinking plenty of water, stuff like that. But at the same time, you want to make sure that you're treating yourself a little bit to get some of those feel-good hormones going. So if you like a little bit of chocolate, maybe eat a little bit of dark chocolate, that really good stuff that's really good for your heart health as well. So like that kind of thing. Yeah, exercise is so important. And for those of you who aren't aware, while most of the time you should be able to exercise in your first trimester, when you go through IVF, a lot of times they put some restrictions on you. And for those of you who I said sex should be fine unless your healthcare provider has told you otherwise, a lot of times in IVF, you aren't able to have sex. I have a couple questions on placentas. Okay. So this came on my Placenta Previa video. So the first one says, does having a posterior or anterior placenta previa have a higher percentage of moving up? So let's talk about what that is. You got a uterus. At the bottom, you got a cervix. Okay. Going towards you guys, anterior, posterior, because your uterus is like a big bubble, right? Okay. The placenta, when it starts, generally speaking, will attach to the side of the uterine wall. Okay. Now, sometimes the placenta won't go there. And in fact, what it'll do, remember we got our cervix? So at the cervix, it will plant itself right over. That's called a complete placenta previa. Sometimes it'll be halfway. That's a partial placenta previa. And sometimes it'll be right on the edge, and that is a marginal placenta previa. Okay. So those are the different positions. Placenta previa is important because if you have a complete or partial placenta previa, you will have to have a cesarean section delivery, and most likely you will have it around 34 weeks of gestational age. This is because this part of the placenta is full of blood vessels to feed your baby. It attaches to the uterine wall, and that's what gives the baby all the things it needs. Well, if it's also over your cervix, parts of it are still on the uterine wall. If your cervix starts to dilate, now these blood vessels are open, you're going to start to bleed out. It's a hemorrhage for you, it's a hemorrhage for baby, it's a medical emergency for both. So we don't want you, if you have a placenta previa, to ever have a chance to dilate, and therefore we usually deliver you early, and we have to deliver you cesarean section because your cervix is being covered. When this person says, what are the chances of it being moved, which unfortunately I can't give you a percentage chance, this is what they mean. The uterus starts out like small, and over time during the pregnancy, it gets bigger and bigger and bigger and bigger, right? So you're going from small to big. Well, when this happens, your placenta might be down here when it's tiny, but then as it gets bigger, the placenta migrates because it's attached to the wall. So it migrates to the wall as it's growing out, and it can move away from the cervix. So that's what they're talking about by it moving. Is there a way to know the placenta chance of moving? No. Unfortunately, there's no way for us to tell you. There's no forward, backwards, anterior, posterior. There's just no way. It's variable, and it depends, and every person is different. And I'll tell you, a lot of people ask, like, well, when is it going to move? Generally speaking, it moves as the pregnancy progresses. So, it moves, like if you see it in first trimester, it'll be moving in second and third and whatever. But I have seen people who at 37 weeks had a placenta previa that like somehow was not diagnosed, and then it moves, and it's random. It really is sometimes random. I had a question also on the placenta video. If your placenta comes out a month before your due date, is there any concern for the baby? Okay, so the answer is yes. This is a medical emergency, which is what I told this person. This is a medical emergency. If you think your placenta has come out, you need to go to the hospital. A placenta looks like a piece of meat, like a piece of hamburger. It's very fleshy and jelly and all sorts of stuff. If a piece of the placenta has come out early, that puts you at risk for hemorrhage, bleeding, okay? That means the placenta is probably coming apart. Now, does that mean that the baby is not, does that mean that you've had a stillbirth or you're about to have a miscarriage? Not necessarily. But there are medical emergencies with the placenta, like the placenta detaching from the uterine wall, okay? Now, it's possible that part of that placenta came off and detached, but that's usually a sign that the placenta is not working right, which is a medical emergency. So if you think that you've seen any type or piece of your placenta come out, that you need to just go to the hospital. I wouldn't even call your doctor. I'd be calling an ambulance or heading there straight myself. Okay. That needs to be checked out. And actually, guys, just so you know, if you think you're going to be heading to the hospital because you see something that you don't know what you're looking at, sometimes women will say they have like a lot of bleeding and they're scared, so they go. You can bring your pad with us. You can bring what it is. I mean, put it into some kind of container. You wouldn't be the first person. You won't be the last one. I know it may sound weird, but sometimes showing us what you saw can help, or taking a picture of it. I mean, nowadays we oftentimes all have phones, and really, honestly, that helps you to explain to a provider, what did the color look like? What looks like brown to you might look like yellow to me. So there's a lot of data that can be taken from that. And so, I do tell people it's okay to do that. I had a question on the postpartum hemorrhage video, and it said, it's been 4 months after my C-section and I'm still bleeding. What could the problem be? So if you're still bleeding and you've been bleeding straight on for 4 months postpartum, it needs to be checked out. What could the problem be? It could be a variety of things, but the thing I would imagine the most is a piece of placenta that has been embedded into your uterine wall and has stayed there. So after delivery, you deliver the baby and then you have to deliver the placenta. So the placenta detaches from the uterine wall and it comes out. But sometimes a little tiny piece of the placenta will remain. And that is actually one of the most common causes of a postpartum hemorrhage because the uterus can't contract down because it's not getting the right hormonal signals. See, as long as the placenta is attached, your body gets hormones that thinks it's pregnant, even if the baby's gone. And actually, one of the reasons why a lot of women will not get their milk supply in after they give birth is because they have retained placenta. A little piece of that placenta is still inside. So if you're bleeding excessively and your breast milk doesn't come in, it's usually because you have some placenta that needs to come out. Now, at 4 months, if that is a placental issue, they're going to need to do what's called a D&C. They're going to have to go in and they're going to have to open up the cervix and they're going to have to scrape the uterine wall probably to get that out. But you need to get that checked out. That's not normal and you need to make sure you're okay. We had a couple questions on the sex video, which I really do like to answer because I think sex is very important. As one of them said, I'm 14 weeks pregnant. Everything is going okay, but last night my partner had sex with me and afterwards I had light bleeding. Is this worrisome? So, bleeding after sex can be very normal during pregnancy. The hormones that are there to help maintain a healthy pregnancy, they thin out the vaginal tissue, they dry it out, and you can have some bleeding. You always want to let your healthcare provider know, but most of the time it is considered normal. So, how can you prevent it? Well, for starters, foreplay. Okay. So if you guys are not really ready to have sex and you have penetration before your body's kind of heated up, then the vagina is going to be stiffer and harder, and it's more likely to potentially get these little tears that cause the spotting. So make sure you're having a lot of good foreplay ahead of time so that your vagina's kind of warmed up and softer and looser, and this won't happen. Second of all, lubrication. So during pregnancy, some of those normal vaginal secretions start to dry up. And so using some lubrication can really help because it just augments some of the lubrication that you're missing and it allows for you to have sex that's a lot smoother and gentler and can prevent those things from happening. Now, another one said, I'm 34 weeks and 3 days pregnant, but my pelvis is hurting. Why does it keep happening? My due date is on March 1st. So we have a video on pelvic pain. And so one of the things with pelvic pain is that it's because the ligaments are starting to stretch. Okay. So, what happens during pregnancy is you have this hormone that starts to get produced called relaxin. And it's exactly what it sounds like. It relaxes. What does it relax? All of the joints. Okay. Because your pelvis, right? So, those bones can't all be connected stiffly. They can't be like bone to bone because if it did, it wouldn't be able to open up to let that baby head come down, right? The baby's head needs to have space to do that. So as a result, the relaxin starts to relax all the little joints and the soft tissue that's in between. When it relaxes those joints, this is why you start to see women where they'll waddle. This is also what causes your nose to start to get bigger during pregnancy. It's also what causes your feet to get bigger because all those bones and stuff, it all relaxes and that opens everything up. But if you have a big baby in your belly and everything's relaxing, that baby can start to sit on that pelvic area. And if you have any history of any types of injuries or anything like that, that can really cause a lot of pain. And so it's something that at 34 weeks, there's probably not much that they're going to do. However, because it is pelvic pain, you need to call your healthcare provider and make sure they get a chance to check you out because it could be preterm labor. And that's something that really needs to be looked at. Okay. For those of you who are joining us, feel free to put any of your questions into the chat, okay? So I had a couple second trimester bleeding questions. I'm 21 weeks pregnant. Sometimes I have dark brown blood with a small clot. It happens 3 or 4 times a month. I have no other issues. Should I take bed rest or can I do my normal work? And somebody else said the same thing. Should they do bed rest or normal work? Another one said, I'm 21 weeks pregnant. I have spotting problems. And a day ago, I had blood with mucus. The baby's moving and my tests, the ultrasound tests were not a problem, but I'm worried and I don't know what's happening. So second trimester bleeding is where we start to get a little bit more concerned, okay? So first trimester, there's so many reasons why it can be normal. Second trimester, there are less. So you want to make sure that things are good. A lot of times it's infection or it's a placental issue. Sometimes we don't know. Sometimes it can be a subchorionic hemorrhage, which is a little pool of blood underneath the placenta. And we have a video on that we can link into the description. Now, once we've determined something's going on, the question becomes bed rest or normal stuff. Because maybe like 10, 15 years ago, everybody was on bed rest. Like it was all the time. You had a problem, bed rest. Now we realize that that's actually detrimental to the health of the pregnancy, the health of the mom. So women are at a higher risk for blood clots when they're pregnant. So you have higher clotting factors to prevent a postpartum hemorrhage when you deliver. But as a result, if you go on to bed rest where you're not active anymore and you're not moving around, you will actually be at a higher risk for blood clots. So we don't want you not moving around and being sedentary because it increases that risk. Additionally, if you're not moving around, you're not expanding your lungs. When we walk around, we're expanding our lungs. We take deeper breaths. When you're taking more shallow breaths, you're not really getting some of that movement, you're at higher risk for pneumonia. These two things can be life-threatening to your baby and to you if they develop into, bigger things. So we don't want that. You can gain more weight and you can become diabetic. You can have high blood pressure issues. You can start to develop depression and anxiety. Bed rest is not as safe as we once thought. Now, as far as normal activity, obviously you have to ask your healthcare provider and see what they say. Now, should you be doing heavy lifting? Probably not. Should you be on your feet for 15 hours a day? Probably not. Should you be focusing on resting and taking care of yourself? Yes, you probably should. So it's like moderation. You want to make sure that you're treating your body well. If your body is tired, rest. If you're feeling okay and you haven't been given restrictions, do what you would normally do because movement is normal for human beings. Okay? For those of you who are still here, if you have any questions, please put them in the chat. I'm finishing up and then I'm going to give you a sneak peek at tomorrow's video. So I had a question or I had a comment on one of the videos. It said, I got my blood test on Tuesday and on Friday, I have anemia and a low white blood cell count. And this is on the blood transfusion video. So just so you guys know, it's very important to treat anemia. Untreated anemia can lead to anxiety. It can lead to fatigue. It can lead to sleep issues. Like it's a very big deal. So you want to make sure that anemia is being addressed. And sometimes we need to give you a blood transfusion. Now, if you have low white blood cells, that can actually be a sign of infection. So that needs to be looked at because if you have low white blood cells and a low red blood cell count, there could be a serious infection going on. So you want to be making sure you talk with your healthcare provider so that you can understand what's going on and how they're going to treat you. We had a question on the blood pressure video. I was pregnant in 2020. At 12 weeks, I was found to have high blood pressure and a heart injury due to a long uncontrolled high blood pressure. They eventually did an abortion on me. Is it possible to get pregnant again? All right. So it is possible to get pregnant after a situation like this. Okay. That is very possible. I have taken care of some women with some very serious cardiac issues during my career. If you have serious cardiac illness, you need to have a very extensive conversation with a cardiologist and a maternal fetal medicine doctor before proceeding with a pregnancy. If you have existing blood pressure issues, you're very likely to develop blood pressure issues during your pregnancy, and you're very likely to develop preeclampsia. And we have a video on preeclampsia that we can link into the description. Cardiac issues lead to a placenta that doesn't function well. The placenta starts to calcify, the blood flow isn't good. And remember, the placenta is what's feeding the baby. So that's why placental health is so important. This is why we talk to you guys about blood pressure and also about diabetes. Diabetes affects our blood vessels, and so it can also cause placental issues. But when you go into a pregnancy with blood pressure issues, that placenta is under bombardment from the beginning. So by the time you're into the second trimester, a lot of times babies are having growth issues and other things. Additionally, as your blood pressure continues to rise, this can put your health in jeopardy. So now we're kind of running this numbers game while we're trying to figure out how long can we keep you pregnant for the baby while making sure that your life is not in danger. And unfortunately, this can be very tricky, and it really can be a very complicated situation. So if you have existing cardiac issues, you want to make sure you're talking to your healthcare provider and really making an informed decision about whether you want to proceed with a pregnancy or look into other options. Our last thing was a comment, and it came on my fear of pregnancy video. And it said, I'm 16 weeks pregnant, and it's completely debilitating how scared I am to give birth. I hate needles, I freak out, and I can't handle pain at all. I often hyperventilate at the thought of giving birth. Okay. So for this mom and for any other moms who are having anxiety related to being pregnant, related to childbirth, related to being a postpartum mom, the first thing I would tell you to do is start with therapy. The second you can start with therapy, start with therapy. Postpartum Support International has a lot of online support groups that you can seek out to talk about your anxiety during your pregnancy. Individual therapy to address some of those concerns are also very important. And then even starting to work with somebody like myself, who is a perinatal specialist, like a perinatal psychiatric specialist. So I have many moms that come into me with a lot of anxiety for a lot of different reasons. And I will go ahead, and in many cases, we decide to medicate because untreated anxiety can lead to preterm birth, miscarriage, stillbirth, low birth weight babies, and the list goes on. So treating anxiety can actually be more beneficial for your baby. Additionally, a lot of moms, as we progress, even the moms that I don't medicate, we'll see each other every 2 to 4 weeks. And one of the things I do is I talk to them about what to expect. I let them know the different things they can see. And for moms like you, I would tell you guys, I have tons of different videos up that kind of try to go through some of these pieces of the process. I have a video about what to expect when you get into the hospital that explains all the silly stuff like the paperwork you're going to have to go through. I have a video that tells you what the operating room is going to look like if you're going to have a cesarean section. Okay, there's all these different little pieces that I try to go through because you guys are not alone when you have all these fears. One of the nice things is we can also give you medication for anxiety, medications that we wouldn't give you during birth. Okay, so like for example, Xanax. Xanax is a benzodiazepine. It is not safe for pregnancy. Okay, there's a lot of things about it that you don't want to expose your baby to. However, one time during labor, because maybe you need it to get the epidural in place and to get your IV started, that's going to be okay. So if that's what we need, we'll use that. But the brilliant thing is there's other things that are way less strong than that we can use that have a far safer profile, like Benadryl. Benadryl is one of the best medications for anxiety during pregnancy, and it can be absolutely helpful in the labor room to help you with some of that. So there's so many options that we can give you. But talk to a counselor, talk about your fears, try to start working through as many of the logistics. Counseling is about strategies and coping mechanisms. That's what counseling is about. And that's why counseling could help you. I have one last question to answer. Zarin got it into the chat. I have a history of fibroids and I had a myomectomy 2 years ago. Can that cause any complications with my pregnancy? So it's possible to cause one type of complication with the placenta, and it most likely means you're going to be having a cesarean section. So myomectomies are a uterine surgery. And generally speaking, after a myomectomy, you need to have a cesarean section. We won't deliver you vaginally because there's a risk of a uterine rupture. So usually that's one of the things that's going to happen. Now, there is something that can happen with the placenta. So every time that you have a uterine surgery, this also includes DNC, so that dilation and curettage. So dilation and curettage, some people will associate with an abortion. So understand these don't happen just when a termination happens by choice. They can also happen for a miscarriage. If you have a miscarriage and the remnants of that pregnancy don't come out naturally, you're going to have a DNC. And some women, unfortunately, have to have multiple DNCs. And then you might have a myomectomy, which is basically like the removal of fibroids. So these are all uterine surgeries that can happen. When you've had this type of thing, there is a risk for something called a placenta accreta. There's also placenta increta and there's placenta percreta. So these are different positions of the placenta where it basically invades the uterine wall. Okay. So when you're talking about a percreta, which is extremely rare, it grows through the uterine wall and it can actually attach to stuff like the bladder. Okay. Then the increta is where it gets really embedded into the uterine wall. And so oftentimes, we actually with these three conditions, accreta, increta, percreta, we actually will end up needing to do a hysterectomy when you deliver. So it's just a matter of whether the placenta will detach. If a increta, accreta, or percreta is identified, it is also usually an automatic C-section. You have to have a skilled surgeon to be in the room during that to see if we can prevent a possible hysterectomy. But that is one complication. Rare, but it can happen. 2 tiny fibroids. The reason I'm going through IVF is because my spouse has CF. Oh, okay. So the fibroids are probably not as big of a deal as they probably feel like to you because, as you said, your spouse has, I'm assuming, cystic fibrosis. And so you guys are really trying to make sure this happens. And of course, IVF is a very challenging process with a lot of steps and a lot of places where things can go wrong. So fibroids are actually very common for a lot of women, and you can have fibroids during your pregnancy, and the pregnancy can be completely normal. It just depends. The only bad thing is those 2 tiny fibroids may end up being bigger by the end of your pregnancy because the hormones for pregnancy sometimes will grow your fibroids. So you may end up with 2 big fibroids at the end. You'll just have to wait it out. I'm going to finish up there. For those of you guys who are still here, thank you so much for staying. I really appreciate it. My name is Dr. Samantha. I'm the maternity mentor. I'm very excited that you guys are all here. Please like and subscribe to the channel. It really helps me out. For those of you who don't know, we have now been approved for to be a part of the YouTube health platform. This is a place where you guys can get verified health information from legitimate health sources. We have to submit licensure. They check our content to make sure that you guys are getting verified health content. So we are now a part of YouTube Health, which is very exciting. Tomorrow's video, for those of you who have been waiting, is on postpartum acne. So I've had several questions about it. This is something that's extremely common. It can be distressing for a lot of people who are not expecting it. So please check it out. And it's going to give you everything you ever wanted to know about postpartum acne. We've got some other great videos coming up in the next couple weeks. So we're going to be putting those out. We're here every Monday at 9 p.m. Eastern Standard Time to answer your questions live. This is one of my most favorite things that I like. If you guys have any suggestions for videos, please put them onto any of the videos that you look at. I read the comments, we check them out. We're the ones that are answering you, and we take those suggestions seriously. So, and any questions you have, we are also here on Mondays to answer those if you can't be with us live. My name is Dr. Samantha. I really appreciate all of your support. Thank you so much. Bye for now.